is an advocate about women's health and sharing her story, and has also personally frozen her eggs, who really wanted to share her experience. And I think that it's always a really amazing opportunity for us to partner with patients who have gone through the journey. Because I can tell you, until I turn blue, that it's an easy process and how important it is. But I think it's always so interesting and impactful to hear it directly from someone in your maybe. So just to kind of give you a walkthrough, we're going to have a general discussion about fertility and reproductive health. And then Lindsay and I are going to spend a good 20 minutes or so with the QA session. And then we invite all of you to also ask your questions. We really want this to be interactive and an opportunity for all of us to learn something. And hopefully it's really empowering and informative. So just want to give a few more minutes because I see a lot of people joined us just in the last minute or so, and we'll get started. Lindsay, did you want to say hi?
Oh yeah, sorry, I didn't want to mess up like the muting thing, but hi guys, I think I have a lot of my Instagram followers and blog readers here, and I'm just so excited to be here. I think that as someone who went through this process a couple months ago, I wish that I had attended something like this, because I feel like it would have been really helpful to me and just saved me a lot of time in trying to figure out the answers to questions on my own. So I hope you guys all find this super helpful and insightful, and just demystify the process a little bit more.
Wonderful. Thank you so much, Lindsay. And we're delighted to have your followers. And I know you have such a broad spectrum of people that that reach out to you. And so I think this is just such an amazing opportunity for us to educate the team. All right. So without further ado, we'll get started. So Kindbody is a national network of women's health and fertility practices. We have clinics from coast to coast with truly a mission to make reproductive health and fertility care accessible for everyone. We are truly dedicated to providing a full comprehensive suite of services. Our mission is to really be a place that you can go, whether you are a young person experiencing their very first period and want to better understand birth control, to the full scope of fertility care, from fertility preservation as it relates to egg freezing and fertility treatments, IVF, and everything in between. And so I'm delighted to be here with you. Our entire focus is to make our doctor's offices not seem like your sterile white doctor's office with white coats and degrees on the walls, but really a place that feels comfortable and inviting and a safe place to get the care that you need. Right, so what we do, as I mentioned a few moments ago, we do provide a full comprehensive suite of services. So from a fertility perspective, you can come and see us just purely out of curiosity. So maybe you have no intention of having children anytime soon, maybe even not for another 5 or 10 years, but you just want to check out your fertility, understand better your body. We are a place for you. But we also do egg freezing, embryo freezing, insemination. That could be with donor sperm or with a partner sperm. We also do IVF, which is in vitro fertilization. Again, that could be with donor egg or donor sperm, as well as genetic testing and the full scope of things that are involved in fertility, whether you're trying to prevent passing a disease on to your children or you're just trying to screen for diseases that you may have yourself. We do the full scope of gynecologic care as well. So you can come to Kindbody just as your regular gynecologist for pap smears, birth control, IUDs, management of more complex gynecologic issues like PCOS, endometriosis, fibroids. So we're really that one-stop shop for all of that. And then we recognize that there's so many different paths to parenthood. And so we really pride ourselves in that inclusive nature in the LGBTQ plus community of either helping you understand donor egg, donor sperm, surrogacy, having the access to our reproductive attorneys who can help with those, drafting those important papers, as well as just having that wellness and nutrition and mental health support that are so important for all of us as we go through our regular lives, but become particularly important as you deal with reproductive health issues, whether it may be miscarriage or just difficulty getting pregnant. So we're really here for you to address all of these needs, and all of it with an extra warm touch and compassion and attention to detail. All right. So when we talk about fertility, I think the major thing, the most important factor to understand is that specifically as women, time is our worst enemy when it comes to our fertility and to our egg counts. And the reason for that we're going to dive into, but it's so imperative for us to understand that even though you may be extremely healthy and you exercise and you eat well and you're doing all of these things to be the healthiest version of yourself, our fertility still declines with age. And it's so important to have access to this information and to empower yourself with that knowledge, not in an effort to be scary or make you be worried about it, because I recognize that we all have so many things on our plates to begin with, but just to empower you with that information so that you know, okay, I recognize fertility declines with age. Maybe your plans are a little bit different than you once thought. Maybe you're planning on waiting a long time to have children, or maybe you're waiting for the right partner, or you just want to have a big family, but you're not quite ready to start. All of these reasons are amazing reasons to learn more about your fertility, to understand where you stand. So then you can take actions and be proactive about your fertility, as opposed to waiting till the time comes and then trying to figure out how you can react to a problem you might have. Our focus is to be super proactive and unfold all of the options for you. So whether that's egg freezing or embryo freezing, or just understanding better what your fertility looks like today, becomes an important part of what we do. All right, so why does this matter? I think the reason it matters so much is that we spend the majority of our reproductive years and our reproductive life trying to not get pregnant, right? And our fundamental knowledge about fertility and reproductive health, unfortunately, as a society, is quite low. And the reason for that is we don't really learn this anywhere, right? If you think about it, we have sex education maybe in middle school, and the focus of sex education is how to not get pregnant and how to not get an STD. And so when the time comes where we're actually really, as young women, as professional women, wanting to learn more about our bodies, we really don't have a place to go. And the unfortunate thing is when you do go to an OBGYN's office, or you go to a standard woman checkup and you ask about this, the response is usually, oh, well, don't worry about it. You're young. You know, when the time comes, you'll try and we'll see what happens. And what we want to do is make right by that, and recognizing that this impacts so many people. And especially if you're in a same-sex relationship, or if you're currently single, well, you don't have the benefit of trying. You don't have the benefit of like, well, let's wait and see. And so that's where all of this becomes so important. All right, so let's start at the beginning. Why is time so important as it relates to fertility? And the reason for it is, as women, we're born with about 2 million eggs. And there's no way for us to ever make more eggs, not even with fertility treatment or drugs. So if we're born with 2 million eggs at birth, and then by the time we reach our very first period, so fill in the number in your mind, you probably were somewhere between 9 and 15. By the time we reach our very first period, we're already down to 300. Thousand eggs each month. And that is the reason, that's the key thing for us to be aware of our fertility, to be aware that age impacts our fertility, and then say, okay, well, what can I do? Let me learn as much as I can about my numbers today so I can make the decisions that are right for me. All right, so why is age important? Typically, doctors will, excuse me, typically doctors will tell you the age of 35 is a really important age to keep in mind. And the reason for that is just by the numbers I just shared with you. Majority of women under the age of 35 will have good fertility. By fear numbers game, If you're born with 2 million eggs, under 35, you generally have a good egg count. And typically, by the time we get to 35 and older, our egg count has diminished by the virtue of time. And so that the majority of women over 35 will have a lower egg count, and hence it may be more difficult to conceive. So that's all true. However, 1 out of 10 women under the age of 35 will experience unexplained premature low ovarian reserve, meaning that 1 out of 10 women will be under the age of 35, could even be in their 20s and have low egg counts, and they would never know. So the key to this is to understand that we can't always assume because we're young that our fertility is great. And conversely, we can't assume that just because we're 40, we can't have children. I think it's imperative for all of us to say, all right, I don't want to just assume I'm fertile or not fertile. I want to actually learn about my fertility, learn my objective facts, learn my partner's objective facts, so we can make decisions based not on assumptions, but based on our actual egg counts, based on our actual sperm counts. And that becomes really imperative. The other aspect that's really important to keep in mind, especially when it comes to eggs, is that our egg quality also declines with age. And by quality, I'm referring to the DNA, the chromosomal makeup of each egg cell. So every egg cell in our body is comprised of 23 chromosomes, and every sperm is comprised of 23 chromosomes. So they come together and it's 46 chromosomes, which would be a normal human. Our egg cells, because we're born with all of them, age with us as we age. Remember, an egg cell is just like any other cell in our body. So why do we get wrinkles? Why does our hair turn white? Why does our skin change? Those are all results of aging on our cells. For our egg cells, as they age, that chromosome or DNA starts to deteriorate. That's why women over 35 have higher risk of miscarriage, have higher risk of having a child with a genetic abnormality, have higher risk of Down syndrome. It's due to that decline in the quality or DNA of those eggs. And that's not something that we can test for. So that's where it becomes really important. If you are thinking that you may want to have 1 or more of your children after the age of 35, that's where egg freezing becomes a really incredible thing to consider, because it can provide you the opportunity to have children in the future with your current younger eggs. So what's the bottom line? What's my take-home message with all of this? And what was the message that I gave to Lindsay when we met, several months ago, is that we're never too young or too old, for that matter, to learn more about the specific facts of our egg counts and our sperm and our reproductive health. Not so we can get scared, because I realize this topic can be scary for some people. They're like, well, I don't want to go check my fertility. What if I find out something is wrong? And it's not meant to be scary, but it's meant to be that if you find out, let's say your egg count is low, then we can be proactive and take measures so you can still have children in the future. If we find out your egg counts are excellent, we can still be proactive to save them for the future. Or we can at least keep an eye on your fertility so that you can start seeing, well, what is my personal rate of decline over 6 months, over a year? So options of what you do with the information are infinite, but so important that we all take the time and learn more about our bodies. So what can you do, right? How do you do an assessment? What does it entail? So a fertility assessment is an opportunity to come and check out your fertility. So it starts off with a one-on-one consultation with a fertility specialist. And this can be done either in the clinic or virtually. So the start phase can be either way, whichever is more convenient for you. And what we do during this consultation is talk about your medical history, your surgical history, what medications do you take, your birth control, your menstrual cycles, how many days do you bleed for each month, how long have you been on birth control, have you ever been on birth control, what are your family planning goals, how many kids do you want to have, all of these really important facts. Your family history becomes really important as well. The second and third, fourth step are done in the clinic. So if you did a virtual consultation, we would then have you come into the office to do the other steps. If you started off in person, then we can do all 4 steps all at the same clinic appointment. So the second part is to do a vaginal ultrasound. This ultrasound allows us to look at the structure of the uterus and ovaries, but also do what's called a very important follicle count. Follicle count is an opportunity to see how many eggs does your body recruit in a given month, which is a really important step into learning more about your fertility. The third thing we do is a blood test to check hormones, specifically a hormone called anti-Müllerian hormone. And this hormone gives us an estimation of how many eggs do you have left from that 2 million you were born with. And by combining the follicle count from the ultrasound with the AMH level, I could then tell you definitively how many eggs you have, how fertile are you, is your fertility good, is it average for your age, or is it low? And the last step, if you have a male partner or if you are male yourself, we can do a semen analysis to check your fertility as well, because it's so important that we include male fertility evaluation in this conversation, because a third of couples who have fertility issues, the issue is actually related to male fertility, and it's often something that's ignored. And so we do provide semen analyses within our office that can allow you to then know about the volume, the concentration, the motility, the shape, the swimming, all of which are important factors in conception. So that's the fertility assessment. Did we go 2 slides? Okay. So then let's say you did your assessment and you got back your results through your patient portal, which is really easy to see from the comfort of your phone or from your computer. So then let's say you decided that you are interested in egg freezing. What is the egg freezing process? So egg freezing is a process by which we're basically pressing pause. We're saying, okay, you are born with a group of eggs, you're losing about 1,000 eggs each month. And we recognize that as we age, our egg quality is also declining. So what we do with egg freezing is say, all right, let's take a group of your eggs, let's recruit them and freeze them and save them for you to use in the future. Because once eggs are frozen, one, they stop dying or they stop being lost, and they stop aging. So then you could preserve your 30 or 35 or 39-year-old eggs indefinitely at the age they were frozen. And that becomes really instrumental as we talk about fertility preservation and family building. All right, so who should consider egg freezing, right? The key thing to understand is it really depends on your own personal journey, right? So the questions that I ask my patients are, number one, well, how old are you? And obviously be honest. The second is how many kids are in your ideal family, right? Not in the family that makes sense to you, but in your ideal family. And it's okay if that answer is 0, and it's okay if that answer is 2 or 3 or more. But it's really important for us to be honest with ourselves. Like, how many kids do I want? Are those kids biological, or do I want to adopt? And recognize all of those things are okay. Maybe you want to have one biological child, one adopted child. Maybe you're not interested in having kids ever. Those are all important things to know. The third question is, realistically, how old will you be when you have your first child? And this is so important, right? So you have to take into consideration your relationship status, your career, your finances, your education, all your travel plans, whatever it may be, all of the factors that play a role in family planning. And then the fourth question, which is probably even more important than any of the others, is if you want to have more than one child, realistically, how old will you be when you have your last child? So we have to remember that pregnancy itself is almost a year. It's 10 months, 40 weeks. And the medical recommendation is to wait 1 year from the birth of a child to the start of the next pregnancy. So if we talk about spacing between kids, the bare minimum is 2 years. 1 year of being pregnant and 1 year in between pregnancies. So it's so important to not just think about that first kid you want, but how many kids do you want in total? Because then that really impacts thinking about egg freezing. And does that make sense for you in order to achieve that ideal family? So how does egg freezing work? Egg freezing is a process by which what typically happens, and I usually have a fun tissue box analogy, and I'm in a different space than I usually am, so I forgot to bring it with me. But the way that egg freezing works is we're born with all the eggs we'll ever have. And every month, our body recruits a group of eggs, right? And our brain sends a signal to this group of eggs to help one egg fully mature. That one fully mature egg is typically called ovulation. And that one fully mature egg is the only egg in our body that has the capability or the capacity of becoming a baby, right? So our body recruits a group of eggs. Of this group, one egg becomes mature and is the only egg that has the capability of becoming a baby. Now, in a month where you don't get pregnant, this one mature egg is lost. This entire group of eggs that were recruited are lost. And next month, your body will recruit a new group of eggs, and this cycle would continue until you run out of eggs. So what we do with egg freezing is we say, all right, we have this group of eggs you're going to lose in the next 30 days. And we know that naturally your body only matures one egg, and only a mature egg can become a baby. So what we do is we give you the same hormones that are released from the brain at a higher dose with the goal of making this entire group of eggs mature together, so that once they're mature, because maturity is key, we can extract them and save them for you to use in the future. So key things to understand in this analogy is, number one, we're not stealing from your fertility. So a person could freeze eggs and get pregnant the next month or next year naturally, because the eggs that we're freezing are the eggs you would otherwise lose every month anyway. The other thing to understand is that this process is actually much shorter than we imagine. So key steps are, one, we're only taking eggs that would otherwise be lost, and all we're doing is helping a group of eggs mature. We're not in any way altering the genetics of the egg or stealing from fertility or causing early menopause or any risks of cancers or other medical issues. Okay. So next slide. All right. And so how do the hormones work, right? I just mentioned that we have to give you hormones to help this group of eggs mature. The hormones are administered. They're small, little, tiny injections that go into the fat of your stomach. We teach you how to do them. And they're given over a 10-day period. That's all. So over 10 days, you're giving yourself nightly injections that help your eggs mature. Through our Kindbody portal, we have really amazing videos that you can watch. You have your own designated patient navigators who will be there with you every step of the way to either help you get comfortable with the injections, make sure you know exactly what dose you need, and really kind of hold your hand through the entire process. But it's only 10 to 12 days maximum of injections. That's all. And here's what that timeline looks like. So in this sample calendar, this person would have been on birth control pills. We don't require you to go on birth control pills, but in this example, the person was on birth control. So the stop sign that you see under Sunday would be the day that she would be asked to stop her birth control pills. On that Wednesday with the yellow sign is when she would typically get her period. It's not important if you bleed or not, but let's just say in this example, she got a period 2 days after she stopped her birth control. She would then start her injections on Friday. And the injections are just 10 to 12 days maximum. And in those final 5 days, I don't know if you can see it, but it says tentative egg retrieval. So in those final 5 days is when her eggs would be retrieved. Why does it say tentative? If we can go back, why does it say tentative? The reason for that is that everybody's maturity of eggs occurs at a different individualized rate. So somebody's retrieval may be as early as Monday, another person's retrieval may be on Friday. Again, we're timing it precisely to your individual maturation of your eggs. But the take home is the entire process from beginning to end never takes more than 14 days. How do we retrieve the eggs? So that retrieval is done on one day in the final stages of that 2 weeks. It's a 10 to 15 minute procedure done under a sedation, a twilight sleep. We put a very small needle through the vagina, and the needle extracts the eggs through a gentle suction. So it's not a surgery. There's no stitches. There's no bandages. All done through a small needle through the vagina while you're asleep. And again, it's only 10 to 15 minutes. So we've talked kind of about egg freezing, walked you through the process. So common question that I get from our patients is, how do I choose, or which one's better, egg freezing or embryo freezing? And the key thing to understand is that the technology for egg freezing has really made some huge advances over the last decade or so. There used to be a period of time, which is why some people, when they do Google searches, will find that embryo freezing is superior. That information is old. There used to be a period of time where embryo freezing was much better than egg freezing. And the reason for that is the technology behind egg freezing and thawing was not very good. And so embryo freezing was always our best option. Fast forward to 2012, and we had some huge advances in the fertility world, process called vitrification, where the thawing and freezing of egg cells became perfected. And since that perfection occurred, if you take the same woman, let's say a 30-year-old, and whether she takes her eggs and freezes them as eggs, or she takes those eggs and creates embryos and then freezes them, her eggs are going to behave exactly the same. Their success is going to be exactly the same. Why? The factor is now based on the age and the number of eggs frozen, not that egg freezing is better than embryo freezing or vice versa. So now we make this decision based on an individual's needs, based on your health, your partner's health, and based on your age and other factors that may play a role. So what comes next? You made eggs or you made embryos. They would then be stored in our facilities. We do everything internally at Kindbody for as long as you want. So there's no shelf life. You could freeze your eggs and have them frozen for 20 years and they would still be as good as the day they were frozen. So there's no need to kind of overthink how long they would be there. And once you're ready to use your eggs, we would then thaw them, fertilize them with sperm, create an embryo, and then transfer the embryo in your uterus to grow. That's only if you need them. You may end up freezing eggs, and 10 years from now, you end up having all the kids you want, and you don't need them anymore. At that point, you could just discard them. Key is egg freezing creates options for future family building if you need it. All right, so that was kind of hopefully informative, and I imagine you guys have questions, which we'll get to, but I wanted to kind of hand it over to Lindsay so that she could kind of share her story and what brought her here, and we'll take it from there. But Lindsay, why don't you share your story with our team?
Sure. Hi, guys. So, watching that whole presentation, I wanted to interrupt so many times because I was remembering myself going through the experience and just remembering a lot of the questions I had and things that I now know that I have gone through it. And just to give everyone a little background, I'm totally an open book, and you guys can all message me privately on Instagram after this if you want. But my situation is that I am married, and I am just not totally sure that I want to have kids. My husband and I definitely know that we don't want to have kids right now. Whether or not we decide we are going to want to in the future, I'm not sure. But I kind of knew that I was getting a little bit older, and I, in my mind, thought of this as an insurance policy where, if maybe when I'm 40, I decide that I do want to have children, it's going to be, there's going to be a higher likelihood that I won't run into issues if I had frozen eggs or embryos than if I were to just try starting naturally. And, there was one thing that Dr. Sasan said in the beginning, which is exactly what my experience was when I went, all the years going to my gynecologist. And I would always say, because I'm 34, so I would always say when I turned 30, I was like, I know for sure that I'm not ready. I'm not going to be ready anytime soon. Should I start figuring out fertility stuff, going to get my AMH levels checked and everything? And they always would say, oh, don't worry about it. Don't worry about it. Not now. It's not an issue you have to worry about now. And it's that just kept happening until I was like, okay, maybe I need to take matters into my own hands and make an appointment and find out, because I just, they weren't really putting any pressure on me to look into it. And I really wish that someone had, because I wish that I had done this at the age of 30 rather than 34, because I would have, my ovarian reserve would have been better at 30 than it was at 34. But, I would just say that if this is something you are curious about or looking into, and I've told this to all of my best girlfriends who are kind of in the same situation, just making an appointment is going to, open your eyes, and it's just like knowledge is power. And I think that's what Dr. Sasan said also. And I just felt after my first appointment so grateful that I had like just taken the step and made the appointment. And I know, I'm sure a lot of people here, that's like the hardest part is just making the appointment and going, because it's scary and it's a big decision and it's a lot of money and a big commitment. But I can tell you that you may go to the appointment and find out that everything's looking great for you. And like, you know, you really, it's not something you need to worry about yet. But, you know, I remember I went and I thought in my mind, similar to what you had put in this presentation, well, you know, I'm really young, and like in my mind, I'm young. In my mind, I think I'm like 22, and I feel really healthy, and I eat healthy, and I work out and exercise. And, you know, what I came to realize is actually none of that is relevant in any way whatsoever to like how many eggs I have. And I, you know, when I got my assessment, I have to admit I was a little disappointed. I thought that I was going to be like as fertile as I was when I was 28 or 25, and that just wasn't the case. And I just remember thinking at that appointment, I wish I would have just done this a couple of years ago, or I wish I would have like wouldn't have put it off so long. And, you know, I'm very grateful that I went when I did. But, you know, I would just say if you're hesitant or thinking about it, don't make excuses and continue to put it off. I mean, do it when you're ready, but I definitely wish that I had gone sooner.
Lindsay, thank you for sharing that. I mean, I hear that story so much from women who truly say, you know, I wish someone had told me about this before. I wish I had the opportunity. And my goal is for no woman or man to turn around and say, I wish someone had told me that sooner, and to have the opportunity to at least just look into it. And I think what makes some people nervous is that they're like, well, if I go, that means I'm like signing the dotted line that I'm going to do it. And maybe you're not quite ready for that. And I think that's the thing that I really want to, if nothing else is taken from this conversation today, is just that going and learning more about your body, whether you're a man or a woman, doesn't mean you have to do anything with that information, but just having the information can help kind of relieve maybe some anxiety or take away some of the assumptions we all make. Do you agree?
Yeah, absolutely. And I will add to that I actually did go, I went to a different facility that isn't around anymore, but when I was maybe 28, I want to say, or 29, and I had some tests done and things. And at that time, I just financially I wasn't ready, mentally I wasn't ready. So I was glad that I did it. But yeah, it's like you said, you're not signing up or signing anything away. You're really just like taking away a bit more knowledge about your own reproductive health that like you're not given in the typical annual gynecologist appointment.
And then how was the experience for you? I know a lot of people are very nervous about the injections during the egg freezing cycle, or just how they're going to feel. Will you kind of walk the team through how you felt? What was the actual injection process for you? And then how did you feel physically, emotionally?
Yeah, so I knew maybe one or two people who had gone through the process. And the one thing that I've learned is that every single person's experience is totally different. And, you know, what one person says their reaction or feeling was may be totally different from yours. I had expected during that 2-week or 10-day period of the injections to be, I felt like I canceled all my meetings. In my mind, I was like, I'm not even going to be working. I'm going to be really having a hard time and not feeling good and just like emotional and whatever, stress. And that wasn't the case for me at all. I would say for the 10 days, really up until the last like day or two, I felt 100% normal. Like maybe a little bit bloated. I reacted. I don't know if that's normal or other people have felt the way, but I continued on with my regular life and could barely even, tell anything different about my body other than the fact that I was injecting myself every night at 7 or 8 o'clock. And then after the retrieval, that's when I personally felt like the most uncomfortable. And I've heard different situations from my followers. Followers of mine had said to me, oh, the 10 days for me was really tough and I was so crampy and uncomfortable, but the retrieval was totally fine and I felt great after. For me, it was the other way around. So I think you kind of just need to like go into it and be gentle to yourself during the whole period of time. And yeah, I would just say for me, the retrieval, the process itself obviously wasn't painful because you're under anesthesia. And then for like, I would say 4 or 5 days after, it felt like I was the most bloated I'd ever been in my life. And they were like the worst period cramps I'd had in my life for like 2 or 3 days. And then eventually it just like goes down, and you kind of feel like you have gained a bunch of weight, and it's all sort of just eventually goes away. I don't know if there's a medical term for explaining that. Is it water weight or, but I remember thinking, oh my God, I feel like I just gained 10 or 15 pounds and I'm just going to be like this forever. But that wasn't kind of really what happened.
Yeah, no, what you're describing is precisely accurate. And obviously, every individual is going to be slightly different, which is why you mentioned some of your followers said they felt more bloating during their injections, some felt more bloating after. The reason for the bloating is fluid retention that occurs as a result of the hormones and as a result of your body maturing a large group of eggs. So think about, we normally get a little bloated when we're ovulating one egg. Well, now we're trying to ovulate a group of eggs. But typically that bloating and cramping is gradual and then gradually declines, which is what you were describing. And some people will feel more bloated right before the retrieval. Some people feel a little more bloated right after the retrieval. But the good news is that the entire process takes 14 days. And typically by 14 days after the retrieval, you're usually feeling back to your normal self. And I just wanted to highlight that you can still work and do your normal activities during the egg freezing process. We do advise you to refrain from strenuous exercise and no intercourse, but otherwise, you don't have to take 2 weeks off of work. You can still be productive during that time.
And I would also say that, I think for a lot of people, myself included, the idea of like the shots and injections are one of the most intimidating parts. And it's, I guess, maybe more than anything, just a little confusing in the first couple of days, because you're like, you're overwhelmed. You have all this stuff. You're like, what do I do with it? And at Kindbody, they really did like walk me through exactly, what I needed to do and when. And eventually by like the third day, I felt like I was, a doctor, like injecting myself easily in like 2 seconds. I really was not as bad as I thought. I originally, I'm married, and originally I was planning on having my husband do it for me because I thought that I would be too squeamish to do it on my own. But I actually decided I wanted to do it to myself because I knew a lot of my followers who were following along in the process are single women and going through the process themselves. And I kind of just wanted to make it clear, like, you very much can do this on your own. It really was not as bad as I thought. The needles are like the teeniest, tiniest little like hairpin size needle. It's really not anything to be scared of.
Absolutely. The needles are quite small. And I do want to reiterate that we really do go above and beyond to make sure you're comfortable with the injections, so much so that we even have team members that can FaceTime or Zoom meet you at the time of your injections to help you if you need it. But we are more than willing and able to teach a friend or a partner or anyone who you trust to give you the injections. I know some people really do have big needle phobias and the idea of giving it to themselves, but it's certainly possible. It's the thing, you're right, that most people are the most nervous about. And by the second or third day, people feel like they're doctors, or they play a doctor on TV, and it does become easily overcome. And I do want to stress that this is not, I know, Lindsay, you're married and have a husband, but this isn't something that by any means of the imagination is for people that are married or people who are heterosexual. It really is for every walk of life. And whether you're a person who anticipates having a child on your own as a single mother by choice, or you plan on doing reciprocal IVF, you're a same-sex female couple and you want to retrieve eggs so that you could create an embryo for your female partner to carry in her uterus in the future, or you want to freeze eggs to utilize in a gestational carrier because you yourself are not able to carry a pregnancy for whatever reason. It really is for all walks of life, and is really a wonderful opportunity to have that peace of mind that you mentioned.
And I just wanted to share one other piece of advice that I got from a follower of mine who had gone through it multiple times, and I think it was one of the best things that I took with me throughout the process, was that she said, every time she went through a few rounds, and the first round, she was very obsessive. And every time she went into an appointment, she would like look at the screen and ask the doctors a million questions and how many are they seeing and how's it going? And just kind of got in her head about the whole process. And then it didn't go that well. And then the second time she just decided like, my obsessing over it is really not going to change the outcome because our bodies are going to do what our bodies do no matter what. And to save yourself the stress and headache and just try to, you know, go about it as relaxed as you possibly can be, knowing that it can be a stressful experience for people. But I just remember in all of my appointments thinking that it would totally have been in my nature to be, you know, asking a million questions and how am I doing compared to the average person in this stage, or how many eggs are we thinking? And I guess, you know, I'm glad that someone had said to me, just, you have to, you know, let your body do what it's going to do, because losing sleep over it isn't going to change the outcome. And I think it's just something that I've like told other people as well.
Absolutely. I was noticing a few questions, and then I definitely want us to get into the benefits and employer benefits. I know you have some thoughts about that, and insurance, and we'll get into the money stuff. I see a lot of questions on that. But one of the things that I really wanted to stress was that this is definitely something that you should look into from just learning more about your body. And then if you do choose to do egg freezing, it's something we really as women need to do for ourselves. You know, this isn't something you're doing for your relationship or for your mom or for your grandma who can't wait to have great grandkids or whatever it is. It's truly something to do for yourself, to say, I'm taking this proactive measure for me, for my own sanity, for my own, as a gift to my future self, so that I can kind of live a life of no regrets. And I really want to stress that it's a thing to do as a choice for yourself, and is not meant to be something we do for society or society's vision about us as women or anything like that. And I hope that message resonates clearly with this audience, because I think it's such an important thing to do for yourself, not for anyone else. So let's talk a little bit about the finances. I saw a lot of questions, and this time is going by so quickly. So at Kindbody, we do accept all major insurances. So, you know, everything from Blue Cross, United, Cigna, Aetna, etc. So we do accept all the major insurances. So coming in for your fertility assessment is going to be very similar to going to your regular gynecologist office. So we're billing to your natural insurance. We're in network with all the insurances you see here on the screen, and it's no different. So you may have a copay or you might have a deductible, but it's not going to be any added expense. Any blood work we do will be through your insurance. Ultrasound is done through your insurance. Even semen analyses are covered by many insurances. So that piece is going to be just a standard doctor's visit, like you go to any other doctor's visit. And if you come to us for routine gynecologic care, contraception, IUDs, again, that's just like your regular OBGYN office, goes through your insurance, and you're just responsible for any copay or deductible. Now, egg freezing is a whole different story, right? Egg freezing is considered elective, and no major medical insurance, like your standard Aetna, Cigna, Oxford, United, all of the things you see on the screen here, are not going to cover elective egg freezing under your standard insurance, with rare exception of someone who has been diagnosed with a cancer, meaning you yourself have cancer, and then in that case, some and many insurances will cover it. But other than that, it's not going to be covered by your regular insurance. The way that some people get it paid for, and the way that it can be covered, is that some, and it's becoming more and more common, more and more employers are starting to cover egg freezing as a benefit, meaning that, you know, the Google and Facebooks of the world, and by the way, it's no longer just Google and Facebook, it's a lot of companies that are choosing to provide this elective benefit for their employees, recognizing that it's now something that is, as the workforce is aging, as women are waiting longer to have children, they're recognizing this is something that's imperative to provide to people. And so they're now starting to add, in addition to your major medical insurance, they're adding secondary benefits that would then pay for egg freezing or pay for a portion of egg freezing. So what I would encourage you to do is, especially if you have an employer, is contact your benefits or HR department and say, do we have egg freezing or fertility benefits? And if the answer is no, this is something we actually champion. We're working really hard as a company to get employers to add fertility benefits, because we think it's just as imperative of a right for people to have fertility benefits as it is for them to have regular health care or medical benefits. So it's something that if you reach out to us and say, hey, I work at X company, we don't have any fertility benefits, or we don't have any egg freezing benefits, but we would really like for you to champion this cause for us, it's something that we as a company can do, and we're actively working on doing. Now, as a side, you can use your FSA and HSA to pay for portions of either your visits or towards egg freezing. That is possible, even if you don't have fertility benefits. So HSA, FSA cards can be used to pay towards the egg freezing. And then if you don't have coverage, just to kind of go over the prices with you. So the fertility and family building assessment, if you have insurance, it would just be a copay. If you don't have insurance, it's normally $300, but if you use the code August101 or AUG101, we'll give you a 50% discount, and it'll be $150. And then our egg freezing cycle through Kindbody is $6,000, and an IVF cycle through Kindbody is $10,000. Again, use the code AUG101 when you book your initial appointment. Booking an appointment does not in any way mean you must freeze your eggs or do IVF. All it means is that you would then get those discounts if you choose to do those processes in the future. And then IUI, which is intrauterine insemination, again, with the code AUG101 is $1,300. One thing to just note, the egg freezing and IVF and IUI costs do not include the cost of the medications, and we would go over that with you on a case-by-case basis, because that does vary dramatically from person to person. And we do have discount programs that we'll tell you about for the medications that can be really helpful. Lindsay, did you feel like that was a good run through? How was your financial experience through this? Did you feel like it was clear? You had everything at your fingertips?
Yeah, I think that I definitely wish that I would have had everything more mapped out, so that at the very end I would know exactly what the costs were going to be. And I think something that I didn't pay as much attention to that I should have was the medication costs, and how the initial medications that you are prescribed, that's just a starting point, and you may need to increase throughout the process. I just didn't assume the amount of money that the medications would be, and that they could increase as you're going along the process, depending on how your body is reacting to the medications.
Yeah. So the medications are individualized because it depends on your egg count. So this may sound a little counterintuitive, but the more fertile you are, the less medicine you need, because your body's already fertile. You have a high egg count, so it requires very little hormone injections to stimulate maturity. The lower or more poor your fertility is, the more medicine you need to get those eggs to mature. They're a little more sluggish, for lack of a better word. So the medication costs can range, and this is just ballpark, from $3,000 to $7,000. And again, once we do your fertility assessment, we would then be able to tell you specifically what we anticipate your cost to be. And we do have really amazing discount programs that we will tell you about that you can apply for, that can cover, for some people, just depending on your finances, huge portions of the medication costs. It just depends on your income, what you qualify for. And lastly, we do work with a third party that would then allow you to also do financing options. So if you don't have the insurance, you don't have the benefits, you don't have employer benefits, and you're paying out of this out of pocket, we work with a company called Future Family that allows you to then pay in installments instead of paying it all at once. So we do have lots of options and that we can help explore with you as far as the cost. And storage is $600 a year, and that's regardless of how many eggs or embryos you have. $600 a year. The first year is included in the cost of the cycle. Let's see, I think, yeah.
Lindsay, I know you had asked your followers if they had any questions. Did we cover most of the ones that people had for both you and Dr. Sasan, or any additional ones you want to? throw our way before we
Yeah, I
let
think,
everyone get
you
on
know,
with their evening?
when I was going through the process and sharing about it with my followers, the most common question people wanted to know was about employers and if they're, how to find out if your employer covers it, and if they don't, how you can sort of navigate that process and how Kindbody can help. So I think you cover that
Awesome.
perfectly.
Awesome. Well, thank you, everyone. If we didn't get to any of your questions, feel free to reach out to us, navigator@kindbody.com. We'll take all of your questions. If you need any sort of help in, getting your employers to offer a benefit, feel free to reach out to us too. We can help you with drafting any sort of letter or communication, sharing the benefits for employers to offer a fertility benefit. Again, it's navigator@kindbody.com. Lindsay, thank you. It's always so nice for everyone who's thinking about doing this to hear it from someone who's been through it and been so open and transparent about their process, the good and the bad. So thank you so much for joining us. Dr. Sasan, always thank you. I know you could do this presentation in your sleep, but we're always thankful that you give it to us and you share everything. So thank you, everyone. Have a good night.
I just wanted to add something for those of you who, we do have locations across the country in New York, San Francisco, LA, Santa Monica, in Atlanta and Austin, Denver, opening in Minneapolis soon, and plan on huge expansions. But if you happen to live in a city or state where we don't exist, you can still reap the benefits. And so in that case, what we would do is set up a virtual consultation with you, with one of our providers. And then we can walk you through the journey, walk you through the steps, and then we can get you set up to have blood work and ultrasound done near where you live, and then do a follow-up consultation with you. So if any of you don't live in a city close to where we have a Kindbody location, I still highly encourage you to make a virtual assessment appointment with us, and then we can help you from there.
Yeah, and Lindsay just reminded everyone she does have a whole egg freezing Instagram highlight, like on her Instagram. So go check it out. It's just called egg freezing. Her handle is Lindsay Silb, SILB. Go check it out. She goes through everything. She shows giving the injection. She shows the difference in how her body looked at the beginning and at the end. And even when she first wakes up from the retrieval and is a little emotional. So it's a great highlight. It shows everything that happens from the beginning to the end. So check it out. And thank you guys again.
Thank you. Bye, Lindsay. It was so nice to see you. Bye,
guys.
Good night.
Bye.
That was great.
Bye, everyone. Thanks for joining us. Have a great evening. Please let us know if you have any questions that didn't get answered.
Okay. Thank you. Bye, guys.
All right. Bye-bye.
Bye, Fahimeh. Talk to you soon.
Take care.